Good morning, Arizona. It is Dementia Awareness Week. How many Americans have this condition? And how can you help someone who is dealing with this? More on this coming up. Time now is 8:07. This week is Dementia Awareness Week. It's a condition that affects millions of people in the United States. And Arizona is projected to have one of the highest increases of people living with Alzheimer's dementia in the country. So Dr. Natali Edmonds is the CEO of Dementia Careblazers and is joining us this morning to give us a little more context about how to handle this and, you know, what as a community we can and should be doing. So thank you very much for your time. I guess the initial question for most of us would be, what is the difference between Alzheimer's and dementia?
So Alzheimer's disease is the most common type of dementia.
Okay.
I like to describe it as if you were to hear the word cancer, it would tell you somebody's sick, but it doesn't necessarily tell you what type of sick. Is it leukemia, breast cancer, skin cancer? The same thing is true in dementia. If you hear the word dementia, somebody is having problems with their thinking and functioning beyond what's expected for their age, but it doesn't tell you what type. Is it Alzheimer's disease, Lewy body dementia, frontotemporal dementia? We hear Alzheimer's disease a lot because it's the most common type.
Okay, so if you're noticing that there are changes, I mean, behavioral, cognitive, forgetting things, I mean, what are the first signs that you start to see? I mean, I guess you also don't know what's typical with aging and what's a problem that really needs to be addressed. So what do you do when you first start maybe having some concerns about somebody in your family?
Yeah, so it's important to know that dementia is not a normal condition.
Okay.
And if somebody is starting to show problems with their thinking, it doesn't necessarily mean they have dementia. There are so many other conditions that are treatable and can get great treatments that aren't dementia at all. So you want to be bringing up any changes you're seeing with your loved one, expressing your concern, so hopefully they'll get checked out by a doctor. Not every older adult who forgets something in a room or misplaces something has dementia.
Right.
So a thorough evaluation is necessary, and it really depends on the type of dementia. So everybody thinks it's memory problems, but memory problems isn't even a requirement to have a dementia.
Okay.
It's very common in Alzheimer's disease, which is why we hear about it a lot, but somebody could have problems with language, being able to keep up in a conversation, maybe in social engagements, not really knowing what's appropriate and what's not, their attention abilities. So there's lots of different symptoms. I would say if you are noticing something is off, maybe the person doesn't seem like themselves, they're not doing things they usually enjoy, they're making mistakes you think are out of character, bring up your concern and really encourage them to get an evaluation.
And I think sometimes maybe with older people, you could also be dealing with maybe some levels of depression or anxiety that has maybe been brought on too by the last few years and years that have felt lost, or, you know, connections that felt like they were lost while we were separated for so long. So how do you know what's the right avenue, I guess, like which type of doctor you should be seeing if you just feel like, okay, things don't feel great, so what can we do?
Oh my gosh, that's such a great point. I call these dementia lookalikes. There are so many other conditions that can look like dementia, and depression is one of them. So the best place to start would be with a primary care provider, because they're going to have more information on your background, your history, and they can start running the initial tests to figure out what's going on.
Okay.
It's going to take several medical providers and healthcare providers to come together to officially come up with a diagnosis, because dementia is considered a diagnosis of exclusion. We have to exclude any other condition that it could be first. And so your primary care provider is a great place to start.
And once you do get that diagnosis, I mean, are there effective medications to slow the advancement?
So there's one that's currently just finished phase 3 trials, or is about to finish phase 3 trials, that is showing great promise in terms of not only improving cognitive scores over time, but also clearing up brain plaques. So that's very exciting. There are other medications currently prescribed regularly. It really helps with the symptoms, but not necessarily slowing down the disease process. So
cognitive therapies you could begin right away, though.
Yes.
Well, thank you so much for speaking with us. I know it impacts so many people, and just can be a very cruel disease. It affects everybody who loves that person. So we'll make sure to put the information for your center on our website. You'll just click on As Seen on TV. Thank you.
Thank you, Olivia.